one area that I think all physicians should be, this should be like a required medical course in medical school, or, recertification process, is social determinants of health. We have to start seeing that as a demographic thing when we treat patients, not just their age and their BMI, but also their social determinant of health factor. Like I said in the beginning, we need to stop saying race is the risk factor, but racism is the risk factor. Okay. And social determinants of health, socioeconomic factors, and structural racism are like, they are tied together. Okay. One moves, the one moves the other. The structural racism moves the other. Okay. So you can't really completely separate it. Yes, are there non-Black and brown patients who have poor socioeconomic factors? 100%. 100%. But is there been a history of chronic iniquities and chronic discriminatory practices that have affected white, poor white patients as it affects poor Black patients? Because we know the outcomes are very different even between that. Okay, so it's not just about money. It certainly absolutely is about demographics, about skin color, it's about race and ethnicity. And so I really would love to see our institution of healthcare really put work into teaching this, training the next generations of physicians and healthcare providers about this. I've had to learn this on my own, and it's fascinating to me. It's intimidating because it's such a big thing. It's like, okay, well, how am I, this lone physician, going to help this whole structural problem? But if healthcare is one institution, if one institution in this cogwheel starts to move towards a more equitable, society, or more equitable standard, that can make small ripples and effects that can hopefully affect the whole population.